Today we will be discussing the case of Jahi McMath. Our team developed an argument in support of continuing medical care for Jahi at Children's Hospital and Research Center in Oakland, California. In 2013, 13-year-old Jahi McMath went into Children's Hospital and Research Center in Oakland, California to have several procedures, including a tonsillectomy, to help her breathe better in her sleep. After the surgery, Jahi suffered massive blood loss and went into cardiac arrest. This led to loss of blood circulation and death to her entire brain. Doctors claimed her cerebral cortex, which controls thinking and speaking, stopped functioning, and her brainstem that controls involuntary actions like breathing was completely destroyed. She was examined to have no activity on an electroencephalogram, a device that measures brain activity, no blood flow to the brain, and did not breathe when the ventilation system supporting her lungs was removed. Because of this, Jahi was declared brain dead, so all life support systems would be stopped. Her family refused to accept this, claiming that removing the machines that were performing all of her bodily functions would be the same as killing her. Her entire family claimed these measures were life support, while their doctors felt it was futile treatment for a deceased person. Today we will be arguing on behalf of the McMath family, who want Jahi to continue receiving all medical treatment.
Our first argument that Jahi should remain on the ventilator is that brain death exams may not comprehensively reflect all functions of the brain. So, Jahi's diagnosis of total brain death may not be completely accurate. As explained in the AMA Journal of Ethics, the current criteria used for brain death exams may not actually completely reflect all functions of the brain. The laws in the United States claim that brain death requires the irreversible cessation of all functions of the entire brain, including the brain stem. But the currently accepted guidelines for diagnosing brain death test many, but not all, of the testable brain functions. One function that is often present in supposedly brain-dead patients is the secretion of antidiuretic hormone, ADH, from the posterior pituitary gland. This is in response to changes in blood volume and osmolality, or the concentration of solutions in the blood. This is important to mention because one of the most important reasons for equating the death of the brain being the death of the entire person is because the brain is considered the central organizer of the body. So therefore, when the brain is completely dead, the body can no longer sustain its physiological integrity. Many components of brain death exam measure functions that don't contribute at all to the person's physiologic integrity, such as seeing if their pupils react to light. These tests then ignore functions that, like regulated secretion of ADH, that are actually key components to maintaining our physiological homeostasis. So the main issue with this is that the current testing procedures to determine brain death are actually focused on tests that were selected because they're straightforward and they're easy to perform at the patient's bedside, instead of focusing on functions that are actually essential to our physiological integrity and would actually answer whether the entire brain's function has completely and irreversibly ceased, as the requirements say. So, in continuation, Dr. Paul Byrne, a pediatrician who has questioned the definition of brain death, said in court documents that he visited Jahi and saw her responding to her grandmother's voice and touch with squirming movements. Dr. Byrne said this signifies to him, in his opinion, that she is not dead. He also stated that she should receive treatment because she's alive, just like everyone else with a severe head injury, and that if she gets treatment, she'll have a chance to recover brain function. Our second argument is the argument of autonomy. One principle that it's always important in ethical cases is autonomy. Autonomy is a person's right to make their own decisions as long as they have the capacity to do so. So in this case, Jahi is not able to make her own decisions because she's incapacitated. She's comatose, so she can't make those decisions for herself. Therefore, autonomy is passed to her guardians and her family, and it is then their right to decide what she would want to do if she could say so. Her family claims that in case there's a chance she isn't completely brain dead and she could possibly wake up, then her life's at risk and they need to protect it. And since her heart is still beating, they feel like taking her off life support would be murdering her. Jahi's relatives are Christians, and they state that their religious beliefs hold that as long as her life's beating, Jahi is still alive. Removing her would be a violation of her family's faith of freedom in the United States, according to the First Amendment of the Bill of Rights. Since Jahi's family has autonomy in this case, the doctors should respect their decisions over the life and possible future they believe Jahi still has. Next, in other states in the US, they allow personal religious beliefs to overpower a diagnosed brain death based on neurological criteria, such as in New Jersey. So, in New Jersey, the state has a religious accommodation law in which Jahi would be considered alive had she been in this state instead of California. New Jersey's law on brain death states that the death of an individual shall not be declared upon the basis of neurological criteria if the physician authorized to declare the death has reason to believe that this declaration would violate the personal religious beliefs of the individual. In cases such as these, death is declared only on the basis of cardiorespiratory criteria. So with this exemption, Jahi's family's beliefs, which represent Jahi's own beliefs, would prevent doctors from removing her ventilator or declaring her dead, which would also allow her to remain on health insurance, helping provide financial support for medical costs and resources. In a legitimate matter between life and death, the mere location in which a person is should not determine whether the person is alive or dead.
There are many arguments supporting the view that all medical treatment, including mechanical ventilation, should cease. The primary idea supporting this argument is that Jahi has legally been declared dead using neurological criteria. The brain death exam was performed several times by multiple different physicians who all had the same diagnosis. Additionally, the electroencephalogram showed that Jahi did not have any brain activity. She also did not have any blood flow to the brain or the ability to breathe on her own. According to the Uniform Determination of Death Act, Jahi McMath is legally dead and all medical treatment should cease. The diagnosis is significant as it reflects the doctor's belief that Jahi's condition will not improve and she will never regain consciousness. Continuing to provide care would be futile as it will not improve Jahi's quality of life and it would also be a waste of medical resources. Jahi is dependent on mechanical ventilation, which is a limited resource in hospitals. Keeping Jahi in the hospital takes valuable and scarce medical resources away from other patients whose conditions could improve with access to a ventilator. Additionally, the medical staff must continuously care for Jahi, providing medication, nutrition, hydration, and time-consuming personal care despite the declaration of death. Allowing this medical personnel to focus care on other patients who have not been declared dead would ensure that the staff is not wasting time or resources. Another supporting argument is the right of physicians to deny treatment if they are morally or ethically opposed. The physicians currently treating Jahi should not be required to continue caring for her if they believe doing so violates their personal or professional integrity. As stated in Principle 4 of the American Medical Association's Principles of Medical Ethics, physicians shall, in the provision of appropriate patient care, except in emergencies, be free to choose whom to serve, with whom to associate, and the environment in which to provide medical care. As this case is non-emergent, the physicians at Children's Hospital and Research Center have the right to deny care to Jahi. These arguments, centered around current legal and ethical views on death in healthcare, support the belief that Jahi McMath should no longer receive care at Children's Hospital and Research Center. The Uniform Determination of Death Act and the American Medical Association's Principles of Medical Ethics are well-researched guidelines that allow physicians to successfully care for patients, and Jahi should not be exempt from these guidelines.
When discussing topics revolving around brain injuries, we are talking about a biological category that typically falls into a spectrum, with one end being an uninjured brain and the other declaring the loss of brain function. Parents of patients just above the line of being declared brain dead can have their child continue with life support in chronic care facilities, along with intermittent hospital visits for other related medical issues. Nevertheless, children like Jahi are biologically similar to those just above the line. And just like children just above the line, who typically live for many years, Jahi was able to live for 4 years as she grew taller and went through 3 recorded menstrual cycles, which also confirms that some degree of hypothalamic function. Therefore, Jahi's condition improved after being transferred from the Oakland Children's Hospital, where they did not provide her with proper nutrition and left Jahi's thyroid and adrenal gland untreated. When she was relocated to New Jersey, she received the proper nutrition and hormone replacement before being discharged to live with her mother in a small-town apartment near the hospital, where she was cared by round-the-clock nurses to avoid the use of limited hospital resources. In addition, the MRI done at the New Jersey hospital showed mild atrophy to the cerebral and cerebellar hemispheres, despite the damage done on the cerebral white matter and mid to lower brainstem. This is a significant contrast to chronic brain dead patients who have MRI or CT scans that consistently show a totally liquefied brain due to severe calcifications to the membranes and fluids surrounded by the brain tissue. It is also not confirmed that Jahi lacked blood flow to her brain, since the imaging done to confirm her diagnosis, which includes a MR, angiogram, and a venogram, are not sensitive enough to detect blood flow to the brain. As a result, Jahi's brain tissue may have not been completely liquefied. This indicates the false positivity of the brain death diagnostic criteria, along with the unprecedented results of blood flow tests. In addition, EEGs reflect the electrical activities of portions of the cortex that are directly below the scalp. Consciousness, hearing, and even functional vision can be present in children with congenital absence of cortex function who typically have flat EEGs. Jahi's EEG activity also may have been intermittent in correlation to her responsiveness to her mother's commands, which points out that these tests are not absolute and ignore the field of behavioral sciences when using the brain death criteria. Since brain injuries are not static, Jahi could have slightly recovered from her condition with the proper treatment and medical intervention that she received from the New Jersey hospital medical staff, preventing her from meeting the brain death criteria. Although physicians do have the right to deny treatment, Jahi's medical treatment and diagnosis are suitable examples for healthcare disparities that people of color face. Despite the desegregation of healthcare, race and ethnicity are still defining factors in determining one's clinical outcome. This is the result of implicit and explicit biases that affect treatment options of inner city and rural Americans compared to wealthier urban inhabitants. Medical providers may exercise biases that can prohibit thoughtful consideration of unconscious opinions, as well as lead to misinterpretation of objective evidence. This calls into question if Jahi's race, class, or social status played a role in the quality of care that she received after the tonsillectomy, and whether or not it was a determinant factor for the Children's Hospital to declare Jahi brain dead in order to withdraw her from life support. Therefore, the practice of beneficence and social justice in medicine are fundamental principles in bioethics that should be used in daily practice. Jahi's family wishes to continue life support deserves to be treated with dignity and respect. Due to the complications associated with Jahi's medical experience, as well as her family's interactions with healthcare providers, this case could serve as a milestone to change the quality of healthcare and implicit bias placed on minorities in the healthcare field, rather than focusing on the definitional standards of death.